Hi, everyone. It's Dr. Jikaria. I just wanted to thank all of our wonderful patients for coming to our annual holiday event. I had a great time. It was lovely to meet you all, and I hope you had a great time as well. I had the privilege of giving a talk called Turning Back the Clock: How Modern Procedures Keep You Looking Young, and I wanted to share it with you all. Enjoy. So I just wanted to start off by telling you all a little bit about me. I grew up not too far away from here in Roselle Park, New Jersey, and I spent most of my education up on the East Coast. So undergraduate in Philadelphia at Penn, medical school in Newark at Rutgers, general surgery residency in Providence at Brown, and finally plastic surgery fellowship down in Miami, Florida. And now we're happily settled here in the Lehigh Valley with my family. There's a photo of them, and I absolutely love what I do. Plastic surgery is the best specialty out there, whether it's helping someone feel whole again or feel better in their own skin. It just brings me so much joy. It's important to start out with what actually happens to the face with aging. And so, facial aging is actually a multifactorial process involving skin, bone, and the soft tissue. And by that we mean the fat, the muscle, and the ligaments. All of these layers work together, and therefore they really must be addressed together to achieve harmony. And approaches to restore youthful appearance address multiple factors. There's really a wide spectrum of treatments available, from non-invasive to surgical, and that's my goal today, to kind of go through some of those. The youthful face actually has the general appearance of high, rounded fullness. That means a nice, smooth, high forehead and brow, high cheekbones with full cheek volume, and a well-defined jawline, and then a sharp neck contour when we get to the lower face. And if you look at these images on the bottom here, on the left side of each one is what we represent as a younger person, and on the right side is the older person. And you can see how all of these changes are happening. The brow is falling a little bit lower. The cheeks have sagged a little bit. The jawline is no longer sharp. And if you were to look at the side view, the neck contour was no longer the sharp angle, and instead is kind of rounded out. And we can take a look at that process again in a more systematic fashion. So starting from the top, you see the transverse forehead creases. Those are the lines that are caused by the forehead muscles contracting. We see temporal wasting because there's some hollowing of the fat in our temples. We see the upper eyelids starting to hollow out and maybe some excess skin that sags. We see the crow's feet that happen when we smile on the outer edges of our eyes. We see the tear troughs and the loose lower eyelids that can cause bags and a more tired appearance. We see the flattening of the middle of the face and the drooping of our cheeks. We see those nasolabial folds between the nose and our lips. We see our lips changing in thickness, those marionette lines show up, and those dreaded jowls at the lower face. And then at the neck, you see the creases from the transverse neck folds, and you see a lot of the banding of the muscles of the neck. And so you can really divide the face into three different areas: the upper face, the middle face, and the lower face. And that's how we're going to kind of go through one by one and address some of the different areas. So we'll start by talking about rejuvenation of the upper face, and I'll go from least invasive to most invasive. So here's one that a lot of people already know about. It's botulinum toxin. Some of the brand names are listed here. And what that does is it treats the forehead lines, the frown lines, and the crow's feet of our upper face. And it works by actually weakening and paralyzing the muscles temporarily to avoid the creases that form with movement. And the results are usually visible in about a week, and it usually lasts about 3 to 4 months before it needs to be done again. The next thing we can talk about is filler, and that's hyaluronic acid filler, which is a naturally produced substance by the body, but it's been developed to fill spaces and draw water into areas that could use some more volume. And this is given to the temporal hollows, and the results of this are actually fairly immediate, and the duration can vary, but it's usually months to years as your body naturally breaks down the substance. So you may need to have it again, but it can give a good, durable result for a while. And next we can talk about the brow lift, which is surgical elevation of the brow. It's often done at the same time as other procedures, such as a blepharoplasty or eyelid surgery, and a facelift. And this is actually making an incision hidden within the hairline in order to pull the upper forehead and the temple area a little bit tighter to elevate the brow, especially the part on the outside of the brow. Healing usually takes about 1 to 2 weeks until the incisions are healed, but final results take anywhere from 1 to 2 months or even longer to be fully apparent. And this is kind of the most aggressive in terms of rejuvenating the upper face. You'll kind of find that this fell out of favor for a few years because the toxin products have been so good, but you might actually see that there's a resurgence of this type of procedure as time progresses. And I thought I would try to show some examples of botulinum toxin treatment. So here on the left side is before treatment, the forehead creases, and afterwards. And then here are the frown lines that have certainly softened up quite a bit. And here are the crow's feet, the smile lines that can be softened as well. And now we can move on to talking about the eyelids. So again, continuing from least invasive to most invasive, you could start with filler, which is injected into the tear trough of the lower eyelid, but I would caution that this is only good in certain candidates and skin types, and in some cases it could actually make the appearance of the lower eyelids look worse. So you should really have a conversation with your injector or your surgeon to make sure that this is the right treatment for you. Next is my favorite procedure, the upper blepharoplasty. This removes excess overhanging skin and puffy upper eyelid fat to generate a more refreshed appearance. The healing time takes about 2 weeks, and results are usually visible in about a month once swelling and inflammation have resolved. And it's a really great operation. People absolutely love the way they look. And just like on the upper eyelid, there's the lower blepharoplasty, which removes excess loose skin and puffy lower lid fat to reduce that tired eye appearance. Again, the healing time is about 2 weeks, and results usually appear in about 1 to 2 months once swelling and bruising have significantly resolved. And these photos are a great example of someone who's undergone both an upper and a lower blepharoplasty. You can see with the upper eyelids how much of that extra skin has been removed and how refreshed those upper eyelids look. And then on the lower eyelids, again, you see that extra skin and puffiness has been significantly improved as well. Now moving down to the middle face, specifically the cheeks and the nasolabial folds. So again, you can start with filler, and this can go to either the fat pads of the cheeks to improve the volume loss and to elevate the cheekbones, or it can go to the superficial skin to soften the grooves caused by loose, deflated skin. Again, results are pretty much immediate, but they can last anywhere from months to a year and may need to be repeated again. The next procedure is something called fat grafting, and that's actually transfer of fat from another part of the body, such as the abdomen or thighs, that's harvested by liposuction, and then injected into the fat pads of the cheeks to give a natural filler. Healing time is a few weeks, and the results can take months to be fully apparent, and about 60% of the amount of fat that's injected actually survives to give that plumped up look. And finally, there's the facelift, which is an elevation of the skin, fat, and muscles of the face to correct for loose, deflated skin due to gravity and time. Healing time is about 3 to 4 weeks as swelling and inflammation resolve, and really the results are apparent at about the 6 month mark. And now we're moving down to the lower face and the neck area. So you can start with a botulinum toxin to treat the platysma bands and to reduce the amount of wrinkling of the neck. And just as any other botulinum toxin treatment, the results are apparent in about a week, and the duration lasts anywhere from 3 to 4 months before it needs to be done again. You can also add filler to the jawline, which can add definition and sculpting that can be lost with time or shape changes. Again, the results are immediate, but the duration can vary anywhere from months to years. When it comes to addressing fullness of the neck and the chin area, you can actually add liposuction with or without energy. And the liposuction removes excess fat from the neck and the chin. And then the energy, in the form of some type of electricity, helps the skin contract and tighten. So overall, you get a reshaping of that neck and chin area. And continuing with the lower face, but now moving on to the most invasive. To address neck laxity and those bands, you can also do a neck lift in combination with a facelift. And this is, again, elevation of the skin, fat, and muscles of the face to correct for the loose, deflated skin, in addition to tightening of the muscles of the skin and the neck to restore the sharper angle of the neck. Healing time, again, is 3 to 4 weeks, and results are apparent in about a few months. And I wanted to show these photos as an example of a before and after of a face and neck lift. You can see that the patient looks like a much younger, refreshed version of herself. She's got a great outcome with the neck contour improvement, and overall, I think she has a really good result. And so when we meet for a consultation for facial rejuvenation, We do a methodical anatomical assessment of the entire face. We look at the forehead, the eyelids, the cheeks, the mouth, the neck, and address those particular areas that might bother you. Overall, the assessment is done as a whole. We look at equality of the facial thirds, symmetry, and the overall shape. We take a look at your skin, the type, the quality, how much excess there is, how deep the folds are, how wrinkled it is, how much sun damage has been accumulated. And we take lots of photos and look at them together. And we also take a look at any existing asymmetry and kind of get an understanding of your expectations. You might wonder who the right candidate is for a facial rejuvenation procedure. It's usually a healthy, motivated patient who will invest the time and effort into getting a great result. Facial rejuvenation surgery may not be for you if you have underlying medical problems such as heart disease, uncontrolled diabetes or hypertension, or poor functional status. If you're a smoker, unfortunately, delayed wound healing and skin flap necrosis are very common among smokers. And if you're on any medication that increases your bleeding risk and that cannot be stopped, such as blood thinners. And if you feel like you're not quite ready for any major facial rejuvenation procedures, there are other things you can do in the meantime. You can talk to our injectors. Botulinum toxin can do wonders to slow down the wrinkle formation process, and fillers can address the subtle signs of aging as they happen. You can talk to our estheticians. Regular skincare, lasers, peels, and especially sunscreen can significantly delay the aging process. And starting early is important. Thank you so much for watching. I hope it was informative. If you have any questions, please reach out.